Hi, welcome to the Huntsman Mental Health Community Conversations. For the month of June, we are talking about from pronouns to parades, how to support the mental health of the LGBTQIA+ community. As we know, individuals who are part of the LGBTQIA community experience increased mental health issues and access not only the healthcare institutes, but throughout the country as well. And so we are hoping that we will provide some knowledge and some education to the community of trying to support the LGBTQIA community. So we know that LGBTQ adults are twice as likely as heterosexual adults to experience a mental health condition. Transgender individuals are nearly 4 times as likely as cisgender individuals to experience a mental health condition. So my name is Jess Holsbauer. My pronouns are she, her. I am a licensed clinical social worker, and I manage our adolescent and child day treatment programs here at the Huntsman Mental Health Institute. I'm really excited to join the conversation today, and I'd like to introduce my colleagues. We have Dr. Anna Doherty, who is a psychologist and statistical geneticist. We have Joanne Cook, who is a licensed clinical social worker in our TeenScope day treatment program here at the Huntsman Mental Health Institute. And we have Ariel Malin, who works at the University of Utah Health Transgender Health Program and is also a health equity consultant and community leader. Dr. Doherty, would you mind saying a bit more about yourself and your work?
Yes, thank you. I'm Anna Doherty. My pronouns are she, her, and I have a kind of a unique niche at HMHI. I'm a clinical psychologist, and so I practice at the downtown clinic, seeing mostly adults and doing psychotherapy. And then I also am a researcher here at HMHI, and I specifically study suicide. And we've been studying suicide in Utah for some time. We have a big research team here looking specifically at suicide in Utah. And so when I marry my research with my clinical practice, I think about, okay, what are some intervention targets that I'm seeing in my research that I can translate to my clinical work and vice versa. So I've been working with LGBTQIA adults, adolescents for several years, and it's a topic of real importance to me, and I'm also aware that the prevalence of mental health conditions in these individuals in Utah is quite high, and so I'd like to really get at some of the risk factors for suicide that relate to LGBTQIA communities, and to help just foster discussion.
Thanks so much for joining us today. Joanne, would you mind sharing a bit more about yourself?
Yeah, I'm Joanne Cook, pronouns she, they, and I'm currently a therapist at TeenScope, which is an adolescent day treatment program. Though I've been part of the mental health community for a long time, and I've worked with adults. I've worked with a lot of different populations, but the last 7 years have been specifically with adolescents. And this kind of a forum really matters to me, not only because we're seeing kids dying, but we're seeing a lot of suffering that is completely unnecessary. And this is my community, so it really matters to me.
Thank you. Ariel, would you mind saying a bit more about yourself and the work that you do?
You bet. So my name is Ariel Malin, and I use she and they pronouns as well. As just mentioned, I currently work for the Transgender Health Program. In my free time, I also serve as a health equity and DEI consultant. I also just finished a 5-year term with the Board of Directors for the Utah Pride Center. And I personally identify as bisexual, queer, femme, and polyamorous. So my day-to-day with the Transgender Health Program is a lot of different things, because this program is fairly new, so we've had to kind of evolve and adapt to the ongoing needs of our communities. But that can look like community engagement by identifying partners in our community where we can better serve our gender diverse patients. We also do a lot of provider staff and training on best practices on how to best serve, through the use of best practice terminology, helping folks understand what the health disparities are and what resources exist in the community to refer folks to. And sometimes my day-to-day can have some difficult conversations in that because we work in a very large system, not everybody is on the same page about the initiatives that we're trying to move forward. And sometimes that sense of urgency and importance is missed. And that can be really difficult, not only because it impacts our patients, but it can send a message to our communities that we're not prioritizing them. So the reason why this topic is personally important to me is because there is not enough mental health care providers who are competent in affirming and understanding the needs of queer and trans people. And I use competent very intentionally because I think LGBTQ friendly is kind of the word that gets passed around as like maybe the baseline, and it should be the baseline, right? But competent is kind of that next level where we expect that you're pursuing some type of continuing education, that you understand how minority stress and the experiences of repression tied to sexual orientation and gender identity are going to impact my mental health. And so competent is what we're looking for in our providers. And currently, I don't think this content is really integrated in the current curriculum for either social work and or psychology or our medical students. And so it's usually seen as an elective, which means you get to choose whether or not you're going to learn more about this patient population. And in the real world, you don't get to choose who your patients and your clients are. So I hope to bring more of a systematic lens on what our systems can be doing to better serve LGBTQ+ people and their mental health needs.
Well, I'm really looking forward to this conversation. I feel really honored to be in this conversation with you all, with your wealth of experience and knowledge and passion. And for those individuals that are joining us on Zoom, we look forward to answering your questions as well, and we'll answer those to the best of our ability once we've concluded the portion of our panel discussion. So if you have questions or topics that you would like to have discussed, please put that in the Zoom chat and we'll do our best to answer them. So I'm curious, from your perspective, I mean, all of you have a wealth of information, a wealth of experience working with patients, working with families, and patients of all ages, right? We have kids up through adults that you all have worked with. And so from your experience, what are some of the contributing factors, whether they're social or personal, financial, familial, or maybe even physical health issues that negatively impact, and specifically negatively impact, the LGBTQIA population's mental health, right? Because we know that mental health, right, doesn't exist in a vacuum. There's a lot of contributing factors. So if you would speak to that, and especially to any experiences you have with specific patients, obviously not sharing any of their information, but really if we could put a face to it, that would be really helpful as well.
Well, I think one of the things that we know conclusively from research so far is that people who identify as LGBTQIA do much better when they have supportive families and communities around them. That alienation or lack of acceptance from family can lead to disproportionately more depression and anxiety and mental health issues. And that to me is a huge take-home message. I think that is a big target for folks, thinking about what to keep in mind as a family member or a potential ally. What you can do to help most is to often help people feel a belonging, a sense of community, a sense of family.
I love that, and I think that family acceptance and support we see starting at a young age, right? Whether it's through a coming out process or just even attitudes and beliefs in the household up through adulthood. So thank you so much for sharing that. Any other thoughts on contributing factors that negatively impact the community's mental health?
Well, I think the family being supportive. I think the community. Where you are, where you spend most of your day. So whether it's teachers, because if teachers aren't accepting and they're loud about it, then I'm going to feel bullied, and my peers are going to feel like there's permission, tacit permission to bully. So having supportive peers, having supportive adults in my community if I'm a kid or adult. I just need to know that there are places I can go that are safe and that I can let my guard down, my guard down, my guard down, my guard down.
Because the mental toll and mental energy it takes to perform, to fit in, right, to mask can be exhausting. And so I really like that idea of having spaces that individuals don't have to put in that extra effort and can just be. In and of itself can alleviate some of the psychosocial stress, the environmental stress that individuals feel when they're just trying to get by. So yeah, thank you for mentioning that.
And I'll add the piece for adolescents. If I'm spending all of my energy trying to mask, trying to fit in, trying to pretend, and trying to figure out where I can be safe and where I can't, I have no energy left to put toward the developmental tasks that I'm supposed to. Mm-hmm. So I don't have time to gain appropriate coping skills. I don't have time to gain healthy social skills. Mm-hmm. I don't have time or energy for that.
Mm-hmm. It can be exhausting. Mm-hmm. Yeah, thank you.
I would add, from the perspective of many of our trans and gender diverse patients that access the transgender health program, many folks are under or uninsured, and so their access to mental health care in the first place is very, very limited. And many of our patients have to be on Medicaid due to their financial situation or other reasons. And many folks in the community either don't take Medicaid or they're just incredibly hard to get into. And there's still this kind of lingering pathologization of trans folks specifically. We know that homosexuality was removed from the DSM in the 1970s, but gender identity disorder, gender dysphoria are still words that we're using around the trans community and their mental health experiences. And that alone impacts how folks are navigating the healthcare system, from whether or not they can access those gender-affirming mental health letters of support so that they can get surgery if that's part of their gender journey, or just getting that competent provider, right? But that language that we continue to use within psychology, within therapy, and within the clinical practice does impact how transgender people will continue to navigate the healthcare system. And will create barriers if we don't acknowledge that and think about new terminology to decrease that pathologization.
Well, and I think that brings up another question. We know, I mean, Yale did a study that transgender individuals are 6 times more likely to suffer from anxiety and depression, and also to attempt suicide. And so, if we think about, us as a community, right, the Salt Lake City or our neighboring communities, really as a community, what thoughts do you all have on how we as a community can invite or really create an environment in which gender diverse individuals can thrive, not just live, not just get by, but really thrive and be their authentic selves? It's a big question, I know. I know.
Well, I think that representation and is a big deal. So people who can be out and out loud and proud, and just being able to say, this is who I am, and letting people see that someone like me is in the community and I'm not alone. I think that's one thing that my community can do is be supportive and be out. And that piggybacks on, I also can't tell someone else how to be the right kind of gay or the right kind of trans. This is who I am. I've taken responsibility for my journey. You get to take responsibility for yours, but I can walk with you on that, because even if we are all part of the community, we're not the same.
And if we think about the LGBTQIA plus community, really as a minority community, speaking to the larger community, the cisgender community, right? So cisgender individuals whose gender matches the gender they were assigned at birth. If cisgender individuals were to really try to put an effort into creating an environment in which gender diverse people can thrive, what can cisgender people do to really foster that environment?
I think part of that conversation is just recognizing that gender diversity is very natural and very much a part of our human development. So there isn't a a spectrum where there's two ends, right? Cisgender and transgender, and that's all there is, right? So recognizing and acknowledging gender diversity is normal and natural, I think takes away a little bit of the shame in and of itself. But then I think also recognizing when our allies know what barriers we're having to jump through in order to get basic rights, basic access to healthcare, they can help speak for us and take that burden off of us by calling their representatives when they see the hundreds of anti-LGBTQ plus bills that are being passed across the country. And they can say, you know what, I know someone who's trans, or I know someone who's queer, and I know that they're going to be impacted by this bill. So I'm going to use my voice to make sure that my representatives know that this is not okay. So I think having our allies be vocal when legislature is trying to target our community.
Yeah, we have an ethical imperative to be really active allies as family members and providers, community members. We really don't. We don't have any excuse. You know, we can't sort of stand back and let our patients tell us how to care for them, or let our children tell us how to address them or refer to them. We need to take the initiative to learn these things ourselves, become competent, and to really advocate for people in our communities.
So silence is not an option if you want to be an advocate.
It's simply not. And when you are looking at suicide rates and rates of self-harm and suicide attempt in the LGBTQIA community, it's clearly not an option.
I know it's a hot button issue. And one thing I think that comes up frequently is individuals wondering, is it really important to call an individual by their preferred pronouns and use their preferred name? Like, does that actually matter? I mean, we know that the research really clearly supports that it does matter and is a protective factor against depression and suicide. Does it matter? Why does it matter? Why does it matter for us to call people by their name and their pronouns?
Well, I can speak to specific instances of having a kid in my office, and when parents come in, the kid is saying, will you please refer to me with these pronouns and please use this name? And the parents that say, oh, okay, and they demonstrate some curiosity, tell me more about that. The kid tends to blossom. When the parents try to tell them that's not accurate, this is the name I gave you, this is the plumbing you were born with, the kid tends to just wither, and that contributes to depression. It's incredibly powerful. I've been misgendered throughout my lifetime, and you notice. You think about it, if you're misgendered, you know. If I'm called the wrong name, even if my name is spelled incorrectly, I notice. And when someone takes the time to say, oh, how do you spell your name? Or how do you like to be called? Oh, you're making room for me, and you're respecting who I am. And it's significant impact on mental health, at least in the kids I see, myself. It's important.
I would imagine there are some parents who are listening to our conversation. And I think for a lot of parents, if their child is coming out to them with an identity that is different than what parents have thought to be true, that can be really, can really rock their world, right? And so if someone a parent is really taken aback, and they maybe don't know what the right response is, but they know that they love their child and want to be supportive, is there any advice that you would give to parents about how to respond in a way that can be both validating, but also gives them some space to come to terms with what their new reality may be?
Well, I would say the most important thing is connection between parents and children. That if you see your child as a person for who they are, and you connect with them on what they prefer, how they identify, and really sit with them and give them that space, you can actively listen while giving yourself space to process what's, your own feelings about that change for you, really. And it's really about adapting to the needs of the moment for your child, right? You need to take care of your child in the moment and do whatever it is they need.
It almost sounds like you're suggesting both curiosity and really active listening, not only as a way to validate the individual, but also maybe to give the parent a minute to collect themselves as well. Is that fair?
Absolutely.
Okay.
I mean, as a therapist, when I sit in the therapist chair, there are a lot of times when I have a lot to process about what someone is saying,
Sure.
right?
Because you're human, right?
Right.
Yeah,
And I want to give my patients space and some quiet in order to express themselves, sort of mull over what is happening in the moment for myself. And there's no rush. There's no rush to fix everything right away or to get everything perfectly right all the time. Giving your family member sort of the permission to just try to express themselves. And if you are someone who is struggling with a parent or a family member who is not addressing you in the way that you would prefer, really sort of giving them the space to process, okay, why is that? What's getting in the way? Is it, I can't tell you how many times I've heard from families where they try to use the right pronouns for a while, and then somebody slips and they use the wrong one, and then everyone just sort of falls back to what they had been using all along, and it just ends up reinforcing that behavior. And I think just really reminding, being persistent, and giving people space to express themselves and kind of lean into some of the anxiety around it.
Well, and I think similarly to our allies, parents are allies for their kids, right? Allies need a space to dialogue with other allies. So parents need a space to dialogue with other parents who are going through the same thing, so that they're not having to use their child in that conversation. So their child's not experiencing the same thing that the parent is, right? So there are spaces that exist out there, and I'm sure we'll share some resources with y'all around where parents can go to have that conversation and dialogue with other parents, so that they're getting the support they need, but they can have that space separate from their child. And one other thought that came to mind, I can't remember if it was a quote or something, but it was around, we love our kids, but do they feel that love? Like like how we feel loved is going to be unique and different to everyone, right? And so if I'm not feeling like you love me, then we might need to address that, right? So just wanted to add that.
And I think one of the challenges, right, is that when an individual, shares their identity or a change to their identity, it's something that they've thought a lot about, right? And they've come to some conclusions about themselves. But then when they share it with someone who hasn't been, privy to their own journey, that's brand new information. And so I think that extending some grace and allowing individuals who are hearing new information for the first time can really benefit the relationship. And I think that can be really hard for the individual who's coming out, because this is a big moment for them. And of course, everyone wants immediate, support and understanding. And I think allowing for a little grace could help that connection, right, in the relationship. That can be really hard too when you're an adolescent and coming out. So I think maybe if parents could express love as the first response, that could be a way to keep the door open. I'm curious too, Ariel, speaking of pronouns and gender diversity, through your work at UHealth, could you share with us a bit about some of the systematic changes or systemic changes that we're making to be a more inclusive organization when we provide healthcare to gender diverse individuals?
Yeah, absolutely. So one of the things that U of U Health has recently kind of jumped on the bandwagon with is the Healthcare Quality Index. And this is a designation, it's a set of criteria that we need to meet in order to be inclusive to our LGBTQ+ patients, but as well as our LGBTQ+ employees. And all of our inpatient facilities have received this designation now. And this criteria really allows us to hold our system accountable in a way that we haven't been able to before. And I'm sure, I think there's probably lots of initiatives going on across the system that we just haven't really centralized, so we may not be aware of. But this is one that's kind of spread throughout the healthcare system. And then in addition to that, one of the things that we're really trying to do to try to recognize our communities and also be able to measure health disparities in our local communities is through our Soju Committee. So Soju stands for Sexual Orientation and Gender Identity. And it has not been standard for healthcare institutions to typically collect this information of all of our patients. And so that has left us with a big gap of knowledge and research to really measure what's going on in our local communities. So by doing that, we can do things like during COVID, when we were able to pull race and ethnicity information and realize that our Black communities were experiencing higher rates of COVID and testing positive for COVID. We couldn't do that at the time for our LGBTQ+ communities. But as we start to implement this project system-wide, we're saying everyone has a sexual orientation, a gender identity, a sex assigned at birth, and a gender expression, regardless if you identify within the LGBTQ+ community or not. But then we're also saying we need to be accountable for our community's health outcomes, and we can do that by measuring them. So
I love that. Thank you. That makes me proud to hear these are some of the steps that we're taking within our healthcare organization. One of the barriers I know for individuals who identify as LGBTQIA to getting treatment is concern that they may not have access to a provider who is affirming of their identity. And let's talk first about physical health, and let's talk about mental health. What are suggestions or ideas that you can provide about how an individual can try to find the highest quality physical health care with a provider who will be affirming of their identity? I might put you on the spot with that, Ariel.
Sure, yeah.
And it's a big question, and so if you want to even just answer part of it, please do.
Yeah, so from the healthcare specific side, we're still finding ways to make it easier for our communities to find affirming providers. So one of the ways that the U of U Health does this is we have that Find a Doc search tool, and we've tried to do some educational campaigns with our providers to let them know, hey, you can add this to your profiles, which then puts you in this searchable engine so that when patients search for transgender or LGBTQ, those providers are going to pop up across all specialties. And so that will essentially help them find a provider that is knowledgeable about their needs in that specialty. Other than that, I think there probably is a little bit more for mental health providers to indicate that visibility, but I'll let y'all speak to that.
Would you all mind? Yeah.
Sure. Yeah. No, I use that online tool myself, and it's been really useful in helping guide patients to me as a practitioner. And I feel like in mental health, often what I'm doing is helping folks navigate the physical and the mental health care system, helping them understand how to get affirming care and how to take the next steps in a transition, or helping them work on family therapy with allies and family members. I think it's really important to understand that I think everyone at HMHI is pretty invested in maintaining competencies in this area and with these communities. The level of expertise is going to vary quite a lot, and we have such a changing landscape too. I mean, not only are we needing to remain, stay competent in lots of different areas relating to these communities, but current legislation and current events are really relevant to these communities. So I think as mental health care providers at HMHI, I would say on the whole, we're really invested, and we're running focus groups with transgendered individuals about their mental health care and the healthcare system. I'm getting a lot of new information. I wish there were more research already done in this area. There's a lot needed.
One of the things that I do with some of the adolescents when it's time to discharge and they're looking for a therapist, the first thing that I talk with them about is distinguishing what it is that they want treatment for. It's rare, if ever, that they want treatment for being gay or being somewhere different gender. That's not the issue. So it's more about how do you interact with someone who is going to be affirming and not focus on it. I recall early in my career, a gentleman that came in, he was in his early to mid 20s, and it took 3 sessions, and then he said to me, I have to tell you something, I'm gay. And I said, okay, and he said, well, the last therapist that I said that to, my therapy turned into how do I become not gay? So he had a lot of concerns about what the impact on therapy was going to be. And I said, well, if it's not causing you any distress, we're not talking about that. What we're talking about is how to survive the community. That is telling you to be different. So I think preparing individuals to ask the right questions of their providers, provider, and how to go about getting it. Because I might go to a provider who is part of the community. It doesn't mean they're competent. It might mean they're affirming. And sometimes I need competence, sometimes I need affirming. So it's a lot to try to navigate and figure out.
I would say our communities typically use word of mouth too, in regards to finding competent affirming providers. They're on Facebook, they're on social media, and they're saying, who did you go to? Yep. And I'll try that person. Yep. And it's a trial and error. And then I think one thing that came to my mind in regards to being able to show that visibility to your patients outside of those search engines and other tools is that physical space, right? And sometimes patients aren't going to see that, obviously, until they make that appointment and enter your space. But if your website is showing your providers and your providers are using pronouns in their bio, they're talking about their experience with LGBTQ plus people, that's a way for folks to find each other. And then that physical space of, do you have brochures about LGBTQ plus people, their health needs, their mental health needs, depicting LGBT people and their families? Do you have rainbow items in your workspaces? Like, these are visible signs, and research has shown us that LGBTQ plus people will look for those signs in their environment to determine safety and acceptance. So that's kind of something we can do as soon as folks walk in.
I think that's really important. I appreciate you bringing that up. To have visual symbolism, visible signals that this is a safe environment, you are welcome, in and of itself can create an atmosphere of acceptance and belonging. So I really appreciate you bringing that up, because it might seem, I don't know, maybe like it's not important, or is a rainbow flag really going to make a difference? But it does for people who are trying to figure out, is this a safe space, especially for individuals who have encountered spaces that have not been safe for them. So thank you for sharing that, which really leads me to another question. How can, other than having, rainbow symbolism or, having brochures like you've talked about, in the waiting rooms that are LGBTQ affirming, how else can providers, because I imagine there are some providers who are tuning into our conversation, how can they signal, demonstrate, communicate that they are affirming and that the space that they've created is safe for individuals to receive treatment?
Well, I think the first thing is they need to be that before they represent that. So,
can you say more about that?
Well, for instance, when the Guild, Utah Psychotherapist, that's the one.
Which is a great resource, right, for individuals to find affirming therapists.
When I first joined that, I joined when I worked in Idaho, because there was nothing in Idaho. So I was reaching out, looking for resources. And at the time, you joined that, but there was no evidence that, you just sign up, you pay your fee, and none whatsoever. And now you have to have at least some ongoing education for that, which is a good thing. I would like to see that bumped up to even more. But I think But that's one thing. You got to be competent before you say that you are.
That's easier said than done, and I think it it requires constant education, really. And in focus groups, folks have said, you can say that you specialize in this area, but that's not always true in reality. When they see physical health providers, mental health providers who claim to specialize, sometimes the patient would beg to differ.
Yeah.
So, yeah.
I think something that all of our providers and staff members would benefit from, regardless of specialty or background, is some type of unconscious bias and privilege training workshop, because I think that helps us get a foundation of where are we coming from and how do we recognize, because I think a lot of folks are under the impression that marriage equality was everything we wanted, or, yay, homosexuality was removed from the TSM. But there's just so much going on still that is impacting our day-to-day lives that I think folks are just unfortunately unaware of, because they don't have that lived experience. Mm-hmm. So it's not, it's not usually intentional that someone's saying, I'm ignoring that you are experiencing this, but they just don't know. And so going through those unconscious bias and privilege exercises can help folks understand, oh, maybe that's something that I don't have to deal with on a daily basis, but somebody else does. And now I know when they walk into my office that they've already had these experiences of discrimination, bias, and I need to be cognizant of that.
So pulling it back to the community, focus of our panel, right? June is Pride Month, and we know that June is the month we'll see a lot of pride flags. A lot of corporations, right, are making T-shirts or beverages. Some of whom donate those profits to LGBTQ affirming organizations. If we want to think about outside of June, right, outside of Pride Month, how can members of the community be allies the other 11 months out of the year?
I think making room is really important, and often that's done with curiosity. So even though I'm old. And I'm old in the community, and that means that I still have to be curious. Even when I become fatigued, I still have to be curious because there's still a lot I don't know, and there's a lot about the current generation that is different from my generation. We're still fighting, but it's a different fight than I fought. So I have to be curious about it and continue to learn more and learn about what is going on with you. What does that mean? Help me understand. Teach me about this, because no matter how much I know, how much I've experienced, I don't know you. And if I assume that my experience is yours, then I'm not seeing you. And I have to be curious and let you be who you are. And that's on a micro level, day to day, just be open, be curious.
And curious in a way that maybe doesn't push people's boundaries, but allows for open conversation, open communication. I think one of the ways that we can foster that too is when we are unclear about someone's pronouns, rather than assuming, stating, oh hi, I'm Jess, my pronouns are she, her, what are your pronouns, can be a really validating way where we can acknowledge that we don't want to assume, right, and that there is diversity in gender presentation. What are other ways that the community can be active allies outside of Pride Month?
I think another thing besides the curiosity is don't be silent. When you see something, say something. When someone uses a slur, say something. Those pieces, just allowing for, asking pronouns, allow space for people, but you got to stand up, you got to say something when you see it, because the community gets tired of always being, I have to stand up all the time. If someone else stands with me, all of a sudden I'm rejuvenated and okay, I can do this. Well,
I think, Anna, you said that we have an ethical imperative, right? We as a community, I don't mean we as cisgendered individuals or queer individuals or whatever, we as a community have an ethical obligation, right?
Please. It is okay to fly a pride flag, more than 1 month out of the year, and it might be a good idea to fly it all the time to combat all of the hate crimes of flags lost and stolen, and the sort of the the smaller sort of hate crimes that really impact the communities that we're serving. Yeah.
I recently did a training for workplaces, and there's a lot of things that as individuals, maybe we have different strengths as allies and we can use our voice in various ways. So maybe you're a manager and you have a team of people and one of your team members is trans or gender diverse. Taking a moment to look at the policies that you have in your institution and see, what does my dress code look like? Is it gendered or is it inclusive? Do I have a gender transition guideline book to support managers in supporting their trans employees through gender affirmation in the workplace? Like, if those policies are not in place, you don't have the tools to support the folks that you're working with on a day-to-day basis. So policy is a really strong piece where I think our allies can have a voice in as well. And then also speaking with their leaders. I think you mentioned this around, if there's more than one of us having this conversation, the impact is so much stronger, because it's not, we're not singling out the one trans person who's complaining that they're not being treated right at work, right? It's, this impacts all of us. A dress code impacts all of us. So when we fight for the rights of the most marginalized in our communities, we are actually benefiting from those inclusion efforts. People of all identities are benefiting from that work. And then engaging our executive leadership to be on board with that, because they're obviously the ones that get to make those higher level decisions for us. So.
Well, I remember we received feedback, gosh, this must have been maybe 5 years or so ago, about some of our paperwork that asked for, I think it was mother, father, stepmother, stepfather. And I was embarrassed when we received the feedback that that was assuming that it would be a heteronormative relationship and maybe even two parents. And so I remember feeling that embarrassment. Oh my gosh, this is not reflective of our values at all. And then I think being responsive to that feedback, right? And maybe if you feel, uncomfortable, like, ooh, using that as a call to action, rather than, denying or, deflecting. And that was really helpful feedback. We changed our forms to really even communicate on a document, we are an inclusive organization. So I think that kind of awareness and signaling as well can be really important just right off the bat.
Really acknowledging making mistakes too when they happen, because they are going to happen. I mean, I make mistakes all the time, and we're just continually improving our process. I think getting feedback from patients and providers is going to be so critical.
We also ask individuals to, at least in our setting, that if they do make a mistake with misgendering someone, to own that, to apologize only once, not many times, and to make the correction and move on, right? Because sometimes drawing more attention to it, if we feel bad that we made that mistake, can actually make it feel worse. Now, if you've done it 5 or 6 times, it's probably important to do some extra work to really cement that in one's brain, but we're all humans, right? I want to take a turn and take some of the questions from the individuals who have been, participating via Zoom. And someone who's a high school teacher, I think, asked a really great question that I think we've talked about a little bit, but I think really specific to institutions. Asks how I can combat the use of harmful language in my classroom. So, and let's broaden that out a little bit. How can individuals who have some agency or maybe some authority over a space, right? So maybe it's a manager, maybe it's a teacher, maybe it's a youth group leader, what have you. How can they create an environment in which affirming language is encouraged while also quieting harmful language? Thoughts on this?
That is such a great question, and I really appreciate that being brought up. My gut reaction would be to say that modeling the appropriate use of language and the appropriate behavior is obviously like step one, and then really creating an atmosphere where there's absolutely no tolerance for misuse of language and for verbal abuse or microaggressions, and to make that really known right up front. I don't know if you would add anything to that, or.
I think approaching your head administration, whoever that is, and maybe talking to them about what is the culture of inclusion that we want to create here in general, without bringing LGBTQ plus people up right away, and see what they say and see what words come to mind, and then use the words that they're using around that culture of inclusion that most of us, I think, are striving for, and then use that in your argument or your message to them around, well, this is how we can also be inclusive to LGBTQ plus people, and this fits within the mission of our school, and this fits within the policies that we have going here at XYZ school. So knowing the policies, knowing your rights in that space, and using the language of the mission and the culture there is sometimes helpful.
And I think on a very specific, not systematic, but bringing back to the individual, like if I'm a teacher in a classroom, modeling, and then when something doesn't fit, when it's inappropriate and it is an aggression, figuring out what is my script, because I don't want to shame the bully, because bullies usually are bullies because they've been bullied already. So figuring out how to not shame them, being assertive, continuing to invite appropriate behavior, and still having this boundary of we will not tolerate inappropriate behavior. And I still want to figure out how I can nurture a pathway for the bully to come back.
Really like that.
How do I provide for them? Here is the script. Here's what you can do. Here are your options in order to be part of us. And you're not going to be allowed to go this way, but I'm not going to shame you, and I'm not going to push you further into the bully corner.
I like that.
It sounds like you're providing an atmosphere of learning. And so rather than you are doing something bad, oh, this is information that you don't know yet and can learn, right? We use an acronym often with some of the patients I work with, that FAIL stands for first attempt in learning, right? And so if we take the position that, oh, this individual just doesn't know, right? And so rather than shutting them down, but really inviting the conversation for growth and learning, can keep the atmosphere positive as well, right? I think fostering growth, and I mean, working mental health, we have to believe that everyone can change, right? So I like that, of not slamming the door, of really inviting the conversation. One of the individuals on Zoom asked, what are our thoughts on neo-pronouns, which is a fantastic question. And I think, on the evolution, right, of how we think about identity is, I think, more on the cutting edge. And so I hate to put you all on the spot, but would anyone be willing to provide information to the individuals who are watching the discussion about what neo-pronouns are, and then maybe share a little bit about how we can use them or why they're important? It's a big question.
My understanding of neo-pronouns is that they're kind of outside of the traditional ones that we might be familiar with, which are, she, her, he, him, they, them. But then there are some like ze, them, theirs, here, hers, and there are some others as well. And those kind of indicate more of a gender neutral or gender inclusive set of pronouns. And I think in regards to utilizing them, if you're plugging in she, her, he, him, you're going to be doing these well. If you're not familiar with a set of pronouns and someone's like, oh, I use these, and you're like, oh, I've never heard of that, or whatever the case may be, it's okay to ask them and say, you know what, can you tell me how you would use those? Because people are receptive to that. It means that you want to engage them in that conversation and respect them. So seeing how they utilize that. And I think it's funny when we get tripped up on some of this new language, because language has been evolving since the beginning of time, right? And so it's just a matter of catching up to that and recognizing that that is difficult, right? To learn new language, to know what's outdated and what's not. But just recognizing that language does evolve. And the way that it's evolving right now is that it is creating more options for us to self-identify in a way that fits our identities. And that's a good thing.
And I think neo-pronouns are not necessarily new, even though neo would suggest that, right? We know that throughout history, there have been lots of examples of writers, authors, activists, individuals using different pronouns if they didn't feel like the gender binary she, he really fit. I think now they're becoming more well-known. People, I think, are exploring them more. And I also really appreciate that it can be confusing to people. And so again, asking with that culture of curiosity, without judgment, really seeking to understand in and of itself can be validating. So I really like that you can just ask, hey, how would I use that? You don't have to be the expert, right, on their pronouns. Yeah, I really appreciate that. Any other thoughts on different pronoun
I'm
uses?
really grateful to learn that. I knew those pronouns and I had heard that word, but I didn't connect the two. And so I'm learning a lot today.
Oh,
I really
love
appreciate
that.
it. Yeah.
There was also a question from Zoom about, if someone in the community is encountering an individual with whom they want to interact with, but they aren't sure about how to gender them or to engage with them in a way that is affirming. And I love that this question is coming in. What advice do you have for individuals who are just in the community? I mean, maybe they're at the grocery store, I don't know, and they want to engage with the cashier, or maybe they're getting, help at, I don't know, a mechanic, I don't know, and they want to just engage with someone in a way that's affirming. How can people do that in a way that is kind and respectful, not overstepping, but still affirming?
My first thought, someone, a cashier or a mechanic, I think I am more than my plumbing. So I think others are more than their plumbing as well. So I can be an affirming individual of just humanity. I see you as a human. I'm going to interact with you in an affirming way, just being positive and interactive. And if it comes up, or if I engage with you, just how are you today? And you engage back in a really positive way, then the conversation can go from there. And then I can just ask, or I can put it out there about myself, right? And then the reciprocation might come. But that's, yeah.
So you're saying at the end of the day, we're actually just humans interacting, right? And so acknowledging, hi, I'm a human, you're a human, can actually be to some of the most validating ways of communicating with individuals. Yeah.
And if they are demonstrating something, like I have a pin on, if there is some symbolic representation that makes you wonder, then that's almost an invitation to be curious and say, oh, what's that about? And they might say, I just want to be affirming, or they might say, I'm part of the community. It's just like any other topic that you want to engage with someone about. You go step by step without being offensive.
And I think recognizing we sometimes unnecessarily gender things just because our world is very gendered, right? And so we insert these terms like sir and ma'am and you guys, and these things that we don't really think about that necessarily indicate gender, but they do. And so by referring to folks by gender inclusive language, it means removing those terms altogether, or using gender inclusive terms like folks, y'all, friends, everyone. Or if you don't know the gender of the person you're interacting with, defaulting to that gender neutral they, them can be a great way to just not accidentally misgender someone. And then once they fill in the blanks for you, then moving forward with those pronouns. But most of the time it's like, if you're interacting with someone, they've got a name on their name badge, you can use that as well. And that removes gender as well. So
I try to acknowledge there's certain organizations, when people have name tags on, they'll also have a pronouns tag on as a way to affirm. I like to acknowledge that I've seen that, like, oh, I really like that your gender is on your tag. Oh, it's really cool that you guys do that here, just as a way, like, oh, hi, I see you, and I appreciate that, even if I think that they're a cisgendered individual. I mean, I don't know, right? I just like to that human connection. Any thoughts on how parents, especially for younger children, can also help foster this attitude of inclusivity, curiosity, because kids are naturally curious, right? And they're also curious about things that maybe don't fit with what they're used to, right? So whether it's, individuals who have a different skin color, there's often curiosity about that, or individuals whose bodies operate differently or maybe use adaptive devices, there's a lot of curiosity about that. And so, if you have kids that are growing up in, a heterosexual parent relationship and maybe don't have a lot of daily interaction with the LGBTQ community, how can parents help to foster that same culture of curiosity and inclusivity? Again, big question, not an easy answer, right?
I can start. So, I don't work with adolescents, but I think when it comes to anyone who's curious, like giving them a book, giving them something that they can look at with pictures, with words that describe someone's experience. And I'm going to call out a very wonderfully affirming local bookstore in our community called Under the Umbrella Bookstore. And they have dozens and dozens of kids' books around LGBTQ plus identities, whether that's talking about queer parents or queer kids or trans kids and what that experience is like. And I think having those in your home, in addition to the other books that your kids are reading, shows that you are open to talking about the diversity of human experience. And then they're getting a flavor of what that looks like, so that it's not new for them when they interact with someone who is queer or trans, and they have a little bit more information to go off of as well.
It's not their first kind of interaction or glimpse into someone whose life might be different than theirs. Yeah.
And there's enough on media now that of representation, whether it's accurate or not is questionable, but there is a representation. Yes, and I think just being curious again and engaging kids in the conversation about, oh, she has a wife. Huh, do you know anyone like that? I do, and if you don't, maybe you need to expand your social circle.
Yeah, modeling that curiosity for your kids too. Having an open dialogue about those sorts of things. Yeah. I'm not sure I have much to add. Those were terrific responses.
Well, there are about 6 million Americans who identify as members of the LGBTQIA plus community. And out of that small percentage, about 6% of the population, roughly 40% of those individuals will experience mental health challenges. And so I think as a community, right, our ethical response is to respond in a community way to try to be inclusive and celebrate diversity. So, for the individuals who are watching our conversation, what's something that you hope people can really take to heart out of how we expand from pronouns to parades to be supportive of the LGBTQIA community?
I think that my biggest message would be to be as active an ally as possible, to be curious and to sort of pursue self-improvement constantly in the service of making this community really great, in the service of helping Utah and being a great provider, being a really close-knit family or community. I think it's so important to actually not just be accepting, but to really take action on a regular basis, to educate yourself through continuing education or resources online for parents and family, to just continually grow in that way with those you want to support.
So be an active ally. I love it.
And I think it's important to remember that your words matter, and words can be small, and they matter. I mean, in Utah, the top killer of kids in Utah is suicide, and a chunk of those kids, a very disproportionate number of those kids, are part of this community, and it's not right. And words matter, actions matter. So I think sometimes it's easy to sit back and say, this isn't my problem, this isn't my issue, I haven't been mean. Well, have you been nice? Have you been inclusive? Have you, just said one word differently, which can make a significant difference to another human.
Thank you.
I think in addition to that, I agree with both of those wholeheartedly. Normalize talking about gender and sexuality. These are very taboo topics, especially in more red conservative states. And the more that we can just normalize that these are natural parts of being human, the less I think we will feel isolated because of our lived experience. And also, those with lived experience who are coming to you, whether you're a parent, you're a healthcare provider, a mental health care provider, they're the expert in their lived experience. So believe them, trust them, and just find out what are the ways that you can do to support them in that. And I mean, that is, like everyone has been saying, ultimately being curious, asking those questions, and finding that path forward with them. So.
Well, I want to thank all of you, Anna, Joanne, Ariel, for joining the conversation today, for being advocates for inclusivity. I hope that this was helpful for the community, and there'll be a list of resources that we provide via email as well. So thank you so much. Thank you, and thanks for the great work that you do with our patients.